And coming up in this episode,
I got my first student job like 6 months after I moved to Germany. When I heard that, I started researching and looking for courses in Germany. I looked up courses like molecular medicine, biochemistry, marine biology, and then I found infection biology. And I think when I found that, I really liked it. So it cuts across is how to manage tropical diseases or infectious diseases.
and out of curiosity, because there's a lot of debates going on during that time of the pandemic about
Yeah.
the vaccine, the development of the vaccine, that the time was too short. So since you're an expert in this area, maybe you can shed a little light on, was it practical how fast the vaccine was made, and from your experience developing this kind of drugs? This is the real life experiences of immigrants in the diaspora. Welcome to the BO podcast. And I am your host, Becky Onyango. And today we have a very special guest who is going to share the experience living abroad. Stay tuned. Hi everyone, and welcome back to another episode of the BO podcast. I'm your host, Becky Onyango, and thank you so much for tuning in for today's episode. So we have our very special guest here today with us, and this is Michael.
Hi, everyone.
So thank you so much for joining us, Michael. So he's just basically going to take us through his journey or moving all the way to Germany from Nigeria and setting up a business in Germany. So we're going to learn one or two things from him, and hopefully we'll be able to be enlightened. So thank you so much for joining us.
Sure. Thanks, Becky.
So tell us a little bit about yourself, where you come from,
Okay.
and how your journey has been in the education
Yeah.
sector.
So like Becky said, my name is Michael, and I come from Nigeria. I moved to Germany in 2014. I guess like growing up, I probably like most people, if you are more like inclined to science, I wanted to study medicine, become a medical doctor and stuff like that. But good thing I didn't do that.
Yeah, it's not good to always go for something you're not passionate about. So
Exactly.
Yeah.
I mean, I recall back then, some family friends were already calling me Dr. Mike, blah, 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 and stuff like that.
So it was automatic for them. They knew you're going to be a doctor.
And maybe what also encouraged that was because my mom practiced nursing, back then. So, like growing up, I think we were well taken care of medically. My mom could cater to all our medical needs, treat us at home and stuff. So maybe that also like added to it. But anyway, I wanted to study medicine like many other people. And so I was doing more science-related courses. After secondary school, I tried, I think maybe twice in the uni to get admission to study medicine, but it did not work out. I guess, while this was happening, I was slowly beginning to, get discouraged. And I think also at that time, I was beginning to learn gradually things about the internet and stuff. And so I was going, say, maybe a bit to the technology side. But anyway, I studied biochemistry at the uni back in Nigeria in the University of Ilorin. One of the best universities in Nigeria, by the way.
Shout out to University of
Ilorin.
Ilorin.
Yeah. So I studied biochemistry there for 3 years.
Wow.
So I think studying biochemistry, while I did that, I was happy studying it because I felt like, hey, it gave me more opportunities than medicine would have gotten me. I felt like if I studied...
And it's kind of similar. They are kind of related because you guys do...
They're kind of related. I mean...
Similar courses, yeah?
Yeah, if you study medicine, biochemistry is like a core part of medicine that you have to study. So for me, studying biochemistry back then, I just felt like, hey, it was a good alternative to studying medicine.
Yeah.
And I felt like when I come out, I have, it will open me to more opportunities. I can go if I want to like go into something more medically inclined. I could also like work more in the industry or also go to the business sector. So I felt like, I had more options. And so I was happy with that choice.
And how did you know that you had this more... The reason why I'm asking this, how you knew you had more options, is because I've seen a lot of graduates, especially where I come from in Kenya, who've done biochemistry.
Yeah.
And they actually list this course as one of the most difficult courses to have several opportunities in. I don't know if the same is also in Nigeria.
It could be. I mean, it really depends on how much time one takes to know the career path available to them in something they study. And I think we can all agree that when you study at the bachelor's level, you're not so specific. You kind of do a bit of everything, you know. And if you do a bit of everything, so that means you do a bit of things that are related to medicine, you do a bit of things more pharmaceutical, and then you do a bit of things that are like more research-based, organic chemistry, and so on. So just this alone, you know that, hey, you can go organic chemistry way, pharmaceutical, you can go the medical path, or you can also go into the research aspect, you know, just speaking right now. But I guess the bottom line is at the bachelor's level, you're not very specific, that's for sure. You know, so I thought, yeah, biochemistry gives me this opportunity. It's a good choice. And then I finished studying it, and if you know, like in Nigeria, after your university education, you have to go for a 1-year compulsory youth service program,
the NYS,
you know,
yeah.
NYSC. So I did this. So I think I was teaching, I can't remember what I taught again.
Yeah, but you were teaching a subject.
Yeah, I think I was teaching either chemistry or biology, something,
Okay.
one of those two. Yeah, I don't remember anymore.
Yeah.
So I taught this in high school. So anyways, while I was doing all these things, I knew I wanted to further my studies. Okay, and somehow I knew I wanted to do that outside of Nigeria. So I think I was clear about this. And while I was still in the uni, I started researching, okay, where to study and also what to study. So for sure, I took my time to like do the basic research.
Okay.
So also during these NYSC days, it gave me more time to go further into it. I finished my NYSC, then I got a job as a medical sales representative. So I was working for a retail pharmacy back home in Nigeria, and I was covering for them as a medical sales representative in the southeastern part of Nigeria. So I was covering 3 states. So essentially what I was doing is, it was like a new retail pharmacy. Maybe they were like 3 years old or so. And they were still like expanding to other parts of the country, you know, so.
And for this type of position, since you're doing medical sales in a pharmaceutical company, you must be well informed about different drugs, I presume.
Well, I didn't have to study medicine or pharmacy for that, but I just need to know the basics to be able to understand different types of drugs, how to use them, the side effects. At the end of the day, I wouldn't give any prescription.
Yeah.
The doctor would do that. But my job would be know what we have in stock, what it does, who needs it, and where do I have to go and talk about it. So I was not taking responsibility for who takes what, how they take it, no. But I just needed to know what we have in stock, where to go, which hospitals to look out for, which pharmaceutical centers to look out for, and tell them, hey, we have this, we can supply to you. You know. But sense. I mean, you can only sell a product that you understand how it works.
How it works,
you know? It's a lot easier for you to hold conversations on these kind of topics. Yeah. So, and I think I'm someone who likes to, I wouldn't say I like to talk, but I enjoy communicating.
I mean, all salespeople, we are really effective in communication. For you to be a salesperson, naturally, you have to be an effective communicator. You need to know what you're talking about.
Exactly.
So it came very natural for you.
Exactly. It came very natural for me. And a friend introduced me to the owner of the company. And then I approached him. I think maybe I just took up the phone. I called or I walked in there. I don't remember exactly. But the guy was very nice. You know, when I met him, you know, I think he appreciated my communication skills and was like, okay, this is kind of guy we're looking for. In any case, he didn't have a job for me because they were pretty much covered in the southwest of Nigeria. And then I said, hey, how far have you been? Have you been to the southeast? I am from the southeast. How about I take your product there? Like, yeah, that's a good idea. You know, so I successfully established the business there. And it was quite a challenge, but I enjoyed doing it. You know, maybe I felt okay because I am Igbo, and there in the southeast, I was going to be communicating with Igbo people. Although I'm not so proud of my Igbo language skills.
You're not so good at that, yeah?
But in any case, I managed.
You still have time to brush up on them.
Yeah, in any case, I managed. So I think that's, you know, that experience exposed me to other aspect of, you know, other aspect of the career path that I can follow, you know. I started seeing myself more as someone who should be within the business-related areas, say within the medical sector. I can still study something medically related, but I don't have to work in the lab, practice medicine in the hospital, or, I don't know, be doing some kind of research. I can be out there on the field. So this for sure opened my eyes to that. And so I went back again to my research on what I want to study abroad. And I was looking for something that cuts across medicine, biochemistry, and the industry. I wanted something that I can study and I would have more options again, Then I stumbled on infection biology. I can't say how I did, but I was researching and then I stumbled on that. So, but before I stumbled on that course, location-wise, I wasn't thinking Germany,
You're thinking one of the English-speaking.
I was thinking of the English-speaking countries,
Yeah.
like every place but Germany.
Yeah.
But luckily for me, my brother was already in Germany then.
Okay.
And then he told me that, you can actually study in Germany tuition free. So that I feel like that's all I needed to hear.
Yeah.
Immediately I heard that, I didn't even care if I had to study in the language or whatever. I just felt like, hey, tuition free sounds really good. And then Germany is a country that I know nothing about. They don't speak English. I like that.
Why? That's.
I felt like I would be doing something new.
Okay.
If you
So you're up to the challenge of learning a new language.
Exactly. For me, it was more like an adventure, and I just wanted to experience it.
Okay.
I felt like studying something still, going to the UK, US, Canada, Australia. English, it's still the same.
Yeah.
Probably not the same culture, but going to a country that is completely that English is not the official language.
Yeah.
I felt like would be like a plus for me.
Wow.
And then
That's a nice way of looking at it because, a lot of people struggle with the language and they don't find it fun in any way.
Yeah. It has to be someone who wants to take a new adventure.
Yeah.
Yeah. And I think there are some people like that, but majority of the people out there, they just wanted the easy way, so to say.
Yeah.
So that's when I heard that, I started researching and looking for courses in Germany. I totally stopped searching in other countries. And I was really seeing interesting courses in Germany.
So at least you narrowed down your search to only Germany.
I know, exactly. And that really helped, because then I could channel all my energy in one direction. I looked up courses like molecular medicine, biochemistry, marine biology, blah, blah, blah. And then I found infection biology. And I think when I found that, I really liked it.
So what does it entail? So
it cuts across tropical medicine, epidemiology, how you can do basic research, essentially preparing you for, I think the main message for them or what they're trying to promote is how to manage tropical diseases or infectious diseases. So if a disease were to occur somewhere, how can you quickly, as a scientist, manage this disease? And that includes understanding the causative agent of that disease, how it relates to the host, and then how you can quickly maybe identify some drug targets, or how you can develop like effective strategies to prevent spreading of the disease.
Like a vaccine or so.
A vaccine could be an option, or maybe controlling the disease. So it cuts across like medicine, public health administration, immunology, and then host pathogen interaction, stuff like this.
So along the line, you guys get to interact a lot with doctors.
100%.
Researchers in the health world and all that.
Yep.
Okay.
So some of the professors or lecturers then, they are like full-time medical doctors. So they will take us specific courses like clinical, whatever, I don't remember anymore. Some clinical related courses. So they will come and then we will see some clinical cases, either what they are currently working on, what they worked on in the past. But you get an idea to see, okay, how some diseases, how it affects the patient and how they treat the patient, what drug, what effect it has on the patient, how the patient is responding to this drug, and if something went wrong or what could possibly go wrong and all those kind of things. So you really get to, and that's where you see the medical aspect of infection biology. And then on the other aspect, we also would learn about things like, okay, when there's a breakout of a disease, you know, how can this be contained? How can you manage an epidemic situation, you know, or a pandemic situation as well? How can you manage it? You also get to learn how you can, you know, successfully do public health administration. If you were to be in a village where there's no clinic, no healthcare, how can you be able to help the people? So things like you learn a bit of this and that and that.
So I can imagine during the pandemic, you guys had like a real life
Exactly,
situation example.
100%. Because also during my studies, what I did during my master's thesis.
I wanted to ask you, what did you write on your thesis?
So if you recall, there was this Zika virus. I wouldn't call it a pandemic. There was that situation of Zika virus, the outbreak of Zika virus in South America, precisely in Brazil.
Okay.
So
I didn't hear of it.
okay, so I think it was an outbreak that is like carried by species of mosquito, and it was mostly affecting pregnant women, and then the babies of the pregnant women were affected, come out with a small head.
Yeah, I remember it. I remember.
So what I worked on back then was the life cycle of the virus causing this disease, you know, understanding the virus, and then to be able to crystallize the protein structure of the virus as a target or as a candidate for drug development, either drug or vaccine development.
Okay.
You know, for like most diseases, that there are drugs out there in the market or there are vaccines. You know, there's always that reverse engineering of understanding the causative agent of that disease, be it a bacteria or a virus. You understand the structure and all. In my case, it was that Zika virus. My job was to understand. I had to like recreate the virus within a laboratory setting, and then understand the crystal structure, the protein structure of that causative agent. And with this, it would be a good candidate to develop a drug or a vaccine, you know. So
you guys do a lot of lab work, yeah?
100%.
So for your thesis, also for the data collection, you had to be in the lab the whole time?
Yeah. I mean, I had to literally do everything. You know, the whole...
Sounds so complex.
I know. I mean...
For a layman like me. Because I'm just imagining, okay, I'm just imagining when I was in high school.
Yeah.
And when we were taking up chemistry classes, just mixing up the tubes and everything and coming up with now this is actually real life situations.
100%. And this is the good thing about it. I think the interesting thing is you get to see what people within the medical sector, and that includes both doctors, researchers, what they actually do, practically speaking, to understand how to control or cure a particular disease, so to say. So, yes, there was the virus which was affecting people in South America, Brazil especially. So now we had to like recreate it in a controlled system to understand the life cycle and then see, okay, which part of this virus is actually responsible for causing diseases. And then identify that structure, understand it, and then be able to have drug targets that can essentially combat it. Because it's like how most drugs work is, okay, hey, this is the drug, and there's the target in the body where this affects. Of course, there are like many modes of actions, but the classical one would be to block that aspect of the disease-causing agent, be it a bacteria or a virus, from attacking the host. You know, there's always that point, the receptor on the host, where that virus, bacteria, whatever, usually goes to. So you want to identify some drugs that can block that action from happening.
Yeah, and out of curiosity, because, you know, there's a lot of debates going on during that time of the pandemic about the vaccine, the development of the vaccine, that the time was too short. So since you're an expert in this area, maybe you can shed a little light on, was it practical how fast the vaccine was made? And from your experience developing this kind of drugs and all that, like...
Yeah, I mean, the good thing is, this is why research is always going on.
Yeah.
People don't wait until there's a pandemic before they start doing something.
Okay.
For example, even the recent coronavirus, back then during my studies, I also worked on a coronavirus. Of course, not the not the type that not this one that we have now, but I think it was the SARS coronavirus.
Okay.
So if you recall, some years ago there was the SARS
Yes.
epidemic,
Yeah, in the early
So
2000s. Yeah.
because of that, there were already lots of research going around it. So you can be sure that even before this latest coronavirus, many research groups around the world already had potential candidates or potential, let's call it potential candidates that it will make it very easy for them to develop either a drug or a vaccine,
Okay.
The tricky part always is getting to that clinical phase where you have to, say, yes, this is actually worth getting into the clinical phase, which means having to test it
On humans.
on humans, so to say, for example, or whatever they will test it on, So to answer your question, research are always going on around the world, and most scientists, they can already predict, what potential pandemic will come. And I can say for sure that they are like candidates, potential results or something that they've been working on already, just waiting for something to happen. Not like they know something is going to happen, but for example, back then from the SARS coronavirus several years ago, there were already many, many other viruses that people were studying from this family of the coronavirus.
Okay.
There are many of them. So think about it as a household with many siblings. You know the parents, all their kids. Some kids have been very bad kids, and because they were bad kids, that something could come out of these other kids.
Yeah,
so you put them on the radar,
influence.
so you're studying them, waiting if something happens.
Okay.
You know?
Because there's just a lot of debate going on, like how come suddenly so this makes sense.
I mean,
if there was already
they're not like
ongoing
starting
research-
from scratch.
Yeah, because everyone was thinking like you started from scratch.
No.
Suddenly you developed this.
I mean, the basic understanding for sure was already there.
Yeah, okay.
It's like, hey, this is it now. Let's move it further.
Okay, this makes sense. So it's good to be empowered with this kind of information instead of so many. So you'd actually advise, if a doctor recommends that you get a vaccination, then go for it. They've already done the research that is needed.
Yeah, but again, at the end of the day, this is a decision that one would have to take.
To take on their
For
own.
me, as someone coming from, there is scientific perspective, I understand it. I can easily say yes for myself, my family and stuff.
Yeah.
But I think there are also people who are against that. And whatever they say, I think it's a valid argument or discussion and stuff,
Yeah.
I mean, there have been cases where there are like also side effects and stuff of vaccines and stuff. So people have the right to be against it,
absolutely.
among every other thing that's happening.
Yeah, but I think also, just being empowered by information, have the right information at hand, and then from there now you can get to make an informed decision.
It makes it easier to make an informed decision.
Okay, perfect.
Yeah.
So now, moving on from the fact that, after your NYSC, and then you decided to look into the options of studying in Germany. Then you came across the course Infection Biology.
Yeah.
Applied for it in which university?
So that was in the University of Lübeck.
Okay,
Lübeck, or in German, Universität zu Lübeck.
Okay, and this is in which state?
In Schleswig-Holstein. So that's close to Hamburg.
Okay.
So the closest big city is Hamburg.
Okay.
Or if you know Kiel, but it's like really up north. So there is Kiel, Hamburg, or Flensburg. So those are like maybe
the bigger states the bigger
cities around. Yeah,
okay.
yeah.
And then it was a 2-year course in this particular case.
Exactly. It was a 2-year study program. Although I took an extra semester, so I did it for 2.5 years. And I think
that's the good thing about public universities, right?
Yeah.
In your case, it's public, right?
Of course, yeah.
Okay,
it's public, and you have this flexibility, to study longer than the normal study period.
Yeah.
And I think in my case, the main reason was because, I guess this takes us back to that part of being well informed before jumping on something, because I came from Nigeria with biochemistry to study infection biology, which at least for the admission process was okay. But now getting into the actual study program, it turned out that some of the courses or some of the subjects were not subject that I was very familiar with. So I needed a bit more time to catch up.
So you didn't have to take some foundational courses in this case? Or?
I mean, ideally, it's like if you have a background in biochemistry, microbiology, immunology, medicine, and all these kind of related courses, then you qualify to apply
For this
for this course. But when you start studying the course, what you get to learn, you would not know, you could not know that you will see it, you know. In my case, a very particular example was virology. Now, I mean, I did a bit of virology back then in Nigeria, but not
in depth.
Not in depth. I could not really catch up so easily. So I needed to take some extra classes, some study times.
But this is another thing that I've really observed about generally courses that we take back at home in Africa.
Yeah.
They might not be so in-depth, and then when you get an opportunity to come maybe further your studies here abroad, the courses here are so in-depth to the extent whereby even the foundation that you had back at home would not really be substantial.
Yeah, this happens, but also what's more important is that this infection biology, it takes a bit from many science-related courses, you know. So, I mean, I wouldn't blame myself for not having a solid background in virology because I was not. Virology was not a core part of biochemistry back then. I did a bit of it, but I was not. I mean, it wouldn't make sense for the lecturers back then to go so deep into virology.
Okay.
You know,
makes sense.
Different unis, they have like different curriculum for their study programs, and I guess when you start studying something, then you get to understand it. You know, the only difference, or at least what affected me, was I felt like, okay, hey, I wanted to work while studying. I also wanted to have like a good social life. And then plus some subjects like this virology, for example, was not something that I was very familiar with. So I thought, okay, take it slow. Don't do this course this semester, move it to the next semester. Have some time to study a bit more, work, and also just enjoy life as a student. You know? So I think, I mean, I have friends that even took 1 whole year, some 2 years, I mean.
Yeah, I mean, one thing I definitely appreciate about public universities in Germany is the fact that there's that flexibility. And you really have the time to put in all the energy and effort in one course or 2 courses at a time, instead of rushing and doing so many courses and not perform well in them.
Exactly.
So that's also an advantage. Okay. Cool.
And I think that overall it gives you as an individual a better quality of life. You know, so you have the time to do other things that you genuinely want to do, and you're also studying at the same time, you know. And I think I'm someone who really pushes for that, you know, that there's a good work-study life balance.
Absolutely. Okay, so you mentioned that during your time as a student, while you're in the university, you are also working.
Yes, I was also working. So how was the experience? It was really good, yeah. And I think I'm someone who's very open to meeting new people. I want to talk to people, like understand what they're doing, just learn new stuff. So, and I think paying attention to things around your environment is very, very important, because I got my first student job like 6 months after I moved to Germany. I started the studies in November 2014. Around April, May the next year, I already got the first student job. And how did I get that job? In most unis, there are always these mass emails that they send to all students, you know. And I think not everyone takes the time to read through them. Sometimes you find a lot of spams, but okay, sometimes you can also find valuable things, you know. I think my accommodation that I got then, I got it from reading that email. And then the student job also, I got it from there. And I really liked that job because it was a job as a bartender in the city center. A new bar they were just opening the bar, and had not worked as a bartender before. You know, so all they wanted they just wanted people, they just wanted young guys that are, you know, happy and you know, friendly, and just want to do something, you know. So experience did not matter, the language did not matter, and also they were very flexible with the time, you know. And I applied. The bar was not even completed then. You know, they were still building the bar when we got the job. So I started the job. German was not compulsory, but I said I want to, you know, practice my German. You know,
well, because you'll get to interact a lot with the clients.
Exactly.
While they're making their orders.
Exactly.
That's a good move, though.
You know, and And then it was like in the city center, you get to meet a lot of people, you know. So I was doing the job mostly at weekends, some weekdays after studies, you know, and I was studying or learning German on my own. So when I come to work, it was like a good opportunity to practice what I've learned. So most times when I talk to the guests or customers, I don't speak English. I just try to say something in German. So it's always easy to say what you want to say, but it wasn't easy to understand what was said to you.
Yeah.
You know, and I think that the hardest part was taking phone calls, you know, taking reservations or orders online on the phone. It was like, because you pick up the phone, you say blah 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 blah, like someone who can speak the language, and then they go all German on you.
But you know what? The thing that I'm loving about this is the fact that you actually put yourself out there.
Yeah.
You are not shy to make the mistake, even if you are not so fluent in the language, because that actually is what helps you to learn the language.
100%.
Because I think what happens a lot with a lot of us Africans here is we're already too shy because we are not so fluent.
It's like one is already telling themselves, no, I can't do it up front.
I can't do it, exactly.
And I'd be like, why do you have to say that?
Just speak that bad one that you know. And in time you'll start...
it gets better with time, you know?
Yeah.
And I think one important thing is also the surrounding, you know, people you surround yourself with, you know. And this is one question that people really have to ask and answer for themselves when they move abroad. Like, what do you want to become? You know, who you want to become, know that, and then move around with these kind of people. You know, I think back then studying, all my friends were also guys who were studying in the uni as well. So some of them came before me, some later on. We would chill, do stuff together. And it was just easy to influence ourselves in a positive way. You know, I think my friend back then, Victor Onyango, also from Kenya.
He's from my tribe.
Exactly, Victor Onyango. It was very interesting how Victor and I met. Victor was studying medicine there, and we met in, I wouldn't call it a club. It's like this Esther party. You know, in the uni, there's always the party for freshers.
Okay.
You know, so I was in that.
The first one,
Exactly. So I was in this party, and then Victor was there, like OG already there a couple of years before me, and he saw this fresh African guy, and you know, he walked up, and then we talked.
I actually saw. I think he's on. You interviewed on your YouTube channel.
Yeah. I did a video with him on my YouTube channel.
So he's now a doctor now.
Oh, for like over 6 years.
Wow.
Yeah.
Okay, nice.
At least 6 years.
By the way, guys, plug in. Michael here has a really informative YouTube channel. He talks all about opportunities of learning in study opportunities in Germany. You can go check him out. Maybe you can give us the name of the channel. Yeah.
So it's D Akaden, and now you can also find it as Jackpot.travel. I think you will see it in the description somewhere.
Yes. So we will link everything on the information, and also we do have formal partnership agreement in terms of helping you students who are interested in studying abroad. So we'll definitely link you to him. And they have social forum whereby you can go log in, sign up. You interact with students who are also looking for opportunities of studying abroad. And the platform is called?
Settling.
Yeah,
it's called Settling.
So that's the plugin. Go ahead.
Okay. So I think Victor was like really positive influence for me. You know, see someone studying medicine with all the whole challenges, you know, the language and then the study style and all. But I mean, he pulled through, so that was a good motivation. I mean, amongst other guys too. Cut a long story short, I think moving abroad and then the people that you interact with essentially
is really
helps
important.
100%, you know. Because I think the worst thing that can happen to anyone is be with people who tell you can't do this, you can't do that. And most people tell you this because they tell you based on their reflection, you know, what they see. So they see you in them, and which is a really terrible thing, you know.
So always around, when you come to study abroad, it's very vital to choose the right kind of company around you, people who would motivate you to just do the right thing, and you'll be very happy in the long run on how everything turns out. Okay, nice. So that was part of the job experience, one of the student job experience that you had, Then eventually, did you change jobs up until the time when you graduated?
No, interestingly, I stayed with those guys at the bar until I graduated. So when I was moving from Lübeck to Berlin, I told them, okay, hey guys, I'm done with my studies. I'm moving to Berlin. It was really nice. I also, while doing that, I also had like a similar mini job,
Yeah.
more like an event center, but it was only open in summer because it was like a farm and people would come there for anniversaries, wedding stuff and all. So it was mostly open in summer. So I think from the end of April until late September or so. So I was doing both of them, but they were essentially the same thing, like gastronomy. I liked both of them, nice people, you get to interact with the locals, surround yourself with the language, you speak it, you make friends, and it's just empowers you to understand the people and the culture, from within and not what people are telling you from outside.
Yeah.
You know.
That's true.
So yeah, fast forward 2017, I was done with my master's studies. Then I moved to Berlin. It was an easy choice to make to move to Berlin because my brother lives here, and then my uncles, cousins, and some other family members
So you have
live
family here.
So it was just an easy decision.
So this is like home.
Yeah, exactly.
But then that's really good because some of us who came to Europe, we don't have nobody that we know. So that was really good.
Yeah. It was good. It was good. And so I think that also really I think it also helped to shape my decisions, the things, people I would hang out with, and of course helped a lot with many challenges like accommodations and whatnot.
Yes. Because a lot of people have this challenge of accommodation always. So that was so, you're so lucky on that bit.